Decrease swelling and pain in the knee with manual lymphatic drainage techniques. With me, Dana Llewellyn. I'm a certified manual lymphatic drainage therapist. You can do all this sitting, standing, or lying down, but I am going to get a chair out. We're going to start by clearing the lymph node pathways on our way down to the knees, starting at the neck. We have the terminus of the lymphatic system here at the collarbone, so go ahead and just take your fingertips and gently massage in circles just above the collarbone. Pressure is pretty light here, we're not going digging. The intention here is to make some subtle pressure changes in and around the lymph nodes to stimulate fluid movement. So massage in circles like this all along the length of the collarbone, even up the neck a little bit. And the next spot we're going to hit is behind the ears. So gently massage in circles with your fingertips behind the ears. You can imagine sliding the skin over the skull, feeling your anatomy beneath your fingertips here. And see if you can get a sense of fluid and fluid movement, maybe noticing differences between left and right side. Next we'll hit the armpits real quick. So just taking a full hand of contact. The skin of your armpit, massaging in circles. Letting the direction of the circles move in towards the body. The intention here is to clear the pathways and to stimulate lymphatic flow. So we'll hit both sides, of course, gently massaging in circles with a full hand of contact in the armpit. And then we'll take 3 deep breaths with 3 different hand placements on the chest. So first, 2 hands gently press into the top of the sternum, take a deep breath, and then 1 handprint down on the sternum, just applying some pressure with the hands, taking a deep breath. And 1 more handprint down, lower part of the sternum, taking a deep breath. Now we're into the abdomen. Find the point about halfway between where the ribs come together and the navel. Just gently engage in and up. The largest lymph node of the body lives here, and this is a major pathway for fluid from the lower extremity. So this area is really important, and by doing this technique, we're helping to stimulate fluid movement in the abdomen. Then go ahead and take 3 more deep breaths at your own pace, with the intention to rest in knowing that breath is a major lymphatic mover, and by breathing deeply, we assist the body with fluid movement. Now we clear the lymph nodes in the groin. Lymph nodes all along the hip crease here. Take 2 hands and gently rub in circles all up and down the hip crease and into the inner thigh. Just massaging in circles. This is the first step fluid from the knee goes through, so we want to make sure that the inguinal nodes here in the groin are nice and open. Just gently massaging in circles. Spending a little extra time here will really help to open up this area to make work with the knee more efficient. Then finally, we get to the knee. So you can prop your foot up on something to make the knee more accessible, or do whatever you need to make the knee reachable. And bring 2 hands underneath the knee, engaging up into the knee joint, and then up the hamstring towards the hips, creating this semicircle-like movement with the engagement into the knee joint and up towards the hips. Do this several times, keeping the pressure pretty light and adjusting the hand ever so slightly between reps. And then we'll gently start massaging the knee with strokes pulling up towards the hips, similar to working the backside of the knee. So engaging into the tissue with a full hand of contact and almost dragging the skin up the thigh, and then resetting the hands. We're creating this sort of drag of the skin, gentle massage in different areas. You'll stay in one spot for about 5 to 10 reps, and then adjust your hand contact. And do this all over the knee, so on top of the knee, on bottom, on the sides. Do as much as feels good. Can be as general or specific as you want with your hands. And then take that same full hand contact and we'll do skin stretch strokes up the inner thigh from the knee, staying in one position for several strokes and then moving up a handprint. or down a handprint. You can start at the knee or up towards the thigh. But just creating a little bit of a circle with your massage strokes, and the intention of the stroke itself is pulling up from the knee to the hip. So it looks like my hand is making a circle, but I'm actually intending to move fluid up towards the hip from the knee. And you can do the same thing on the upper thigh, just creating those skin stretch strokes with the intention of the stroke moving from knee to hip. And clearing behind that knee one more time with your semicircle strokes up into the knee joint and up towards the hip. And you work your way down shin and calf with those little skin stretch pulls. So full hand of contact, engaging into the tissue, dragging that skin and the upper superficial parts of the tissue, dragging that up towards the knee. Then finally, I like to hit this area underneath the bony protuberances on either side of your ankle, just giving that area a little bit of a massage. Fluid tends to pool here. Then movement stimulates lymphatic flow as well, so pointing and flexing the foot from the ankle while massaging the inguinal lymph nodes of that side. A great way to help pump lymphatic fluid even more, just encouraging that openness of the inguinal nodes. So now we're going to work our way back up all the areas that we just hit on the way down. So hip crease, doing some circles there, then doing the abdomen, the armpits. It's about 5 to 10 circles, just a little massage, nothing crazy. And then finishing up at the terminus at the neck, taking fingertips, gently massaging in circles above the collarbone. Can hit behind the ears as well, just clearing all those areas of lymph nodes one last time. We'll finish up with 3 nice deep breaths, just to close the practice and to help stimulate lymphatic fluid even more. And thank you, body, for all the wisdom contained within.